bold to demand increased staffing and better wages at two major New York City hospitals. It's the largest nursing strike here in decades.
This was really the last resort. We tried since September to reach an agreement, and unfortunately, we're here.
In general, striking is scary. We lose our benefits, we lose our pay for however long this lasts, not just these 3 days, it can go on for weeks.
These nurses taking to the picket line after last-minute negotiations collapsed between their hospitals and the New York State Nurses Association, or NYSNA.
Nurses are walking away from the bed because of the abuse, mentally and physically. We can't take it anymore. We can't take it anymore.
More than 7,000 nurses still reeling from the pandemic and burdened by burnout, finally at their breaking point. Carol McGowan is one of them. She's a neurosurgical ICU nurse who's worked at Mount Sinai Hospital in Manhattan for 30 years.
I've done nothing else for the rest of my life. This is my passion. This is what I love doing.
Like most mornings, she's headed to Mount Sinai. But today, instead of going inside the hospital, she'll be standing outside, along with most of her fellow nurses, calling for change for the third straight day.
You have to sign in?
It's exhilarating being out on Madison Avenue with all your colleagues dressed in red, but it's also very, very sad because we shouldn't be on Madison Avenue. We should be in the building doing the job that we were trained to do, that we love to do.
Carol is a 45-year veteran nurse who came to New York from Scotland 3 decades ago.
They had a shortage of nurses in New York City, so recruits came out all across the world to recruit nurses to come to hospitals. Go full circle to 2023, and we're now at an even bigger staff shortage crisis than we were then.
Defeated. We're nurses. United. We'll never be defeated.
The irony isn't lost on her that she's now the one demanding hospitals fill that staffing gap amid a surge in demand for health care.
We have had enough of telling management time and time again that this is unsafe. When you're 500 nurses short in an institution, those 500 places that are not filled, somebody's suffering from that. And it's the nurses, it's the patients, it's the community that we serve.
A recent New York State analysis predicted that a better nurse-to-patient ratio would result in shorter hospital stays and fewer readmissions. Over 2 years, it would save an estimated 4,300 lives and $720 million. These strikes are the latest example of the tension that exists between hospitals and their medical staff, not just in New York, but across the country.
Do you think there will be a ripple effect across the country?
There are some nurses who feel very strongly about unionization and the need that if you need to strike. And there are other nurses who feel that they could never do that. I think it will have ripple effect. We'll have to see how it plays out.
I don't have a crystal ball, but until this staffing crisis is solved, we're going to see more strikes, larger strikes, because it seems that that is the only way that we've been able to deal with this issue.
These nurse strikes have also become a global movement. Similar demonstrations cropping up in countries like Turkey and Lebanon. And in Great Britain, nurses and ambulance workers went on strike for the first time in UK history.
I just feel it's something that we have to do because we have to have a voice and nobody's listening to us.
In New York, Mount Sinai Hospital responding to this week's strikes.
It has not been a very fair thing that our NYSNA executive team have asked our nurses to make this decision, whether to come to work or to be outside striking.
In a statement, Mount Sinai called the strike reckless and said the nurses' union refused to accept the exact same 19.1% increased wage offer agreed to by 8 other hospitals.
We had submitted to them a very robust staffing enforcement proposal, and we were waiting to get a counter on that, and we did not receive it at the time that they left negotiations.
Mount Sinai has also blamed their vacancies on the national workforce shortage and said that they've hired 4,000 new nurses over the last 3 years. Just a few miles north of Mount Sinai, hundreds of nurses at Montefiore Medical Center
4, 2,
also advocating for what they call safe staffing.
It's not fair to the patients because we cannot take care of them how we want to take care of them. This is not what we went to nursing school for. They promise, oh yeah, we're going to have staffing for you. We're going to have the ratios for you. And you know what? They don't.
Montefiore said today that it's offered proposals to address staffing concerns, including expanding the number of registered nurses on staff, establishing average nurse-to-patient ratios, and introducing new ways to increase recruitment and retention.
What do we want? Safe staffing! What do we want?
But they say that union leadership still hasn't agreed to the concessions. In the interim, both Montefiore and Mount Sinai have relied on physicians, residents, and non-striking nurses to help take care of patients. These protests come as the profession faces national nurse shortages, according to the U.S. Department of Labor.
What do you think's causing it?
One is that the average age of the practicing RN is in the early 50s. We knew this before the pandemic, that in the next 10 years, a significant number of registered nurses are going to retire. And then we don't have enough nursing faculty. There are a significant number of students who are qualified, turned away from nursing programs every year because we don't have the faculty to teach them.
The crisis exacerbated by nurses who want to leave the profession. A survey done last year by the American Association of Critical Care Nurses found that around 67% of nurses plan to leave their job in the next 3 years. But union leaders say no such shortage exists.
The industry wants to say that there are not enough trained nurses, that they can't get those nurses. There are plenty of nurses to go around. What there is a shortage of is nurses that are willing to put themselves, their patients, and their license on the line to help the hospital industry continue this staffing crisis.
According to all the national data that we have from national nursing agencies and workforce experts, there is a shortage, and it's only projected to get worse before 2030, especially in the South and the West.
Nurses on the picket lines in New York,
Shut it down!
Following the lead of their fellow healthcare workers in Minnesota. This past September, nearly 15,000 nurses at more than a dozen different hospitals went on strike, the largest ever among private sector nurses.
All right, we've been standing strong.
It's nurses who are continually striving to give the absolute best world-class care they can to their patients. So we care deeply about the care we give, but it's incredibly distressing to not be able to meet the standards that we hold for ourselves.
Nurses there were set to strike again in December, but came to a deal that included historic pay increases and a say in staffing.
People are feeling heard, and people are feeling like this was a good deal. I would just point out that the feeling amongst our nurses here in Minnesota is that this isn't the end point. This is just the end of the first phase.
In New York, 65-year-old Carol, who plans to retire later this year, considers this strike her last stand.
I want this profession to be safer for the new nurses coming up, for the next generation of nurses.
Nurses like Ali Saznik.
Being able to stand out here in solidarity with them is what the union's about. You know, it's unity. It's coming out in strong numbers to support each other and make a difference.
The nurses out here say they're eager and ready to get back to their patients, hoping to come to an agreement with the hospitals soon.
I would love to get back to work today, but it looks like tomorrow, yeah. Take care of your nurses because we take care of you when you're sick. Let's get back to work.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.